If you're just joining us, welcome to the 7th Annual Health Philanthropy Summit. I'm Jennifer Wood, a senior consultant with Health Giving, and today we are talking about thriving in the world of VUCA. That stands for volatility, uncertainty, complexity, and ambiguity. And right now, to take us through her organization's experience in thriving through complexity and transforming it into clarity is Lisa Zellers. Now, a bit about Lisa before she joins us. She is part of the very talented team at the Aultman Foundation in Canton, Ohio, and she serves as their vice president. She joined Aultman in 2014 as the director of community relations, generations, and spiritual care before assuming responsibility for the foundation in 2016. And prior to joining Aultman, she served as the state agriculture liaison for U.S. Senator George Voinovich and the development director for Meals on Wheels of Stark and Wayne counties. She's a graduate of Leadership Stark County, where she serves on that organization's board of directors, along with Stark Community Foundation's Capital Campaigns Committee, the North Canton Medical Foundation Board, the Lake YMCA Board, and Aultman's Women's Board. So welcome, Lisa.
Thank you, Jennifer.
Now, so complexity comes in to shake things up a bit in our VUCA world, because after all, sometimes it's not enough to be volatile and uncertain. We've got to make it complex too. So Lisa, you and I were talking earlier this week that your segment is brought to us by the letter C in VUCA, and we were going to be transforming the complexity into clarity. But before we get to transforming, I would love for you to share just a little bit more about your organization, describe this Aultman service community to us, to our national audience, and what were some of the driving factors behind the cancer campaign?
Thank you again, Jennifer. Thanks for having me on behalf of our team, and appreciate you and Bill hosting this summit for us every year. The Aultman Health Foundation serves Northeast Ohio. So we are a not-for-profit healthcare system in Stark County and surrounding areas. What makes us unique, Jennifer, is we're vertically integrated. So 3 hospitals, an insurance provider known as AultCare, and then also Aultman College. So with 1,000 beds, over 1,000 providers, and over 7,000 employees, we are Stark County's largest healthcare provider. The Timken Family Cancer Center is a project that was envisioned many years ago. Why this project was so important to our community is Aultman is the leader in cancer care here in our area. We have the talented team, we have the care providers, we have the technology, the equipment. But the one thing that was missing, Jennifer, was having everything, all of our services under one roof for convenient access and navigation for our patients. So that was really the challenge. So as the leader in cancer care for our community, this project was important to everyone to make sure that we were bringing all services together for a true comprehensive cancer care for our community. So that was really the importance of it, Jennifer.
Wonderful, wonderful. And what do you think made the campaign so successful now that you're at the end of it? Looking back, what made it so successful?
Yeah, great question. A lot of people, a lot of resources. And I would say thank you to Minnie on behalf of our team for helping us to be successful. But I would say number one is our patients. Jennifer, our patients are the why behind this project. They remained our focus from day one. I think that was extremely important. Not only did that offer our team and others within Aultman encouragement and energy and excitement around what is being created for our patients. They are the why. They provided that energy for us, and just as importantly, they were the voice of this campaign for us. So I would say first and foremost was our patients' involvement, their support, and their advocacy. And then number two, we went into this project, Jennifer, with a plan, and we began with a feasibility study a number of years ago that actually Bill conducted for us. And not only did he conduct the feasibility study that gave us direction, a roadmap, if you will, he also put together a strategy for us and a timeline of the project. And so we definitely went into this project prepared and planned. Of course, no one can plan for a worldwide pandemic, but however, the fact is that we were prepared when we endeavored into this project. And that was important for us, Jennifer, because the Aultman Health Foundation had not been involved with a capital campaign that we rolled out to the community since the 60s. And I like to say that they didn't leave us a lot of notes. And so this was a new experience for our team. I'm very proud of what our team was able to accomplish, but the fact is that we were learning as we were going. This was a new experience for us. We're a small team, and so a prepared game plan made a big difference for us. Our volunteers, key role in our success were the volunteers that helped make this possible. Our women's board of Aultman Hospital, nearly 300 ladies strong, volunteers, advocates, fundraisers for us in the community, had committed $5 million to this project before we really even got started. And that was tremendous. This was a $28 million project. And so that was a huge step forward for us. So along with our women's board, another key group of volunteer leaders were our campaign cabinet leaders that we assembled to help deliver and share, provide awareness, open doors for us in the community. These volunteers did that for us. And we started out with asking Steve and Lisa Gregory to champions for our community, champions for cancer care, champions for Aultman, to lead that campaign cabinet. With their help, we assembled a group of individuals that were really our advocates and our supporters for this project out in the community. And that made a huge difference for us. So a lot of volunteers, a lot of support, not to mention our board of directors for the Aultman Health Foundation, the foundation itself, just tremendous. So volunteers were key. A lot of community partners, whether marketing, media, companies that joined on board to help us in a lot of unique and different ways, truly instrumental. And then, of course, I would say our communications was first and foremost for us throughout this process. Again, since we had not conducted a capital campaign for a number of years, not only was the fundraising important in this campaign, but how we conducted ourselves, how we rolled out the campaign, how we communicated with our donors, with our community, so important for us to build those relationships and trust. So it was a great opportunity for us. So those are some of our key reasons for success, and many more, Jennifer, probably too.
And 28 million. I mean, that's phenomenal. That's huge. So let's talk a little bit about complexity. So talk me through some of these unique situations that created complexity for the cancer campaign. What was going on? I mean, obviously COVID, but tell me about some of the other leadership changes, or what was going on in your world.
Yeah. So no different than those that are with us today, Jennifer. We experienced, we rolled into 2020 thinking that we are breaking ground in the spring of the Timken Family Cancer Center. We're going to wrap up the campaign this year. And it wasn't long into the first of the year that we realized that we were on a much different track. And I would say operationally, the challenge is that our team began working on things that were not normally in our lane. So when we experienced what we did, again, probably not any different than many of those that are with us today, our team found ourselves involved with helping to get food that was being delivered from donors to our team members on the front lines. We were communicating with donors regarding dollars for masks and equipment needs and other things. Our focus was on COVID. Our focus was on our colleagues, our team members on the front lines. Our focus was on those that we were serving. And so I don't want to say that we were distracted, because we were taking care of what was most important at that time. But we definitely moved and shifted our priority and our focus from the Cancer Center Capital Campaign to the immediate needs of our hospital and of our community. And so that was a challenge for the campaign, if you will. Goes without saying the challenges that we all experience not being able to communicate and connect with our donors and our friends and our partners like we were previously. That required us to kind of get out of that box, Jennifer, and it really
Yeah.
pushed us into endeavoring into new things. And again, not like anyone else, but that was definitely a complexity for us in having to shift the way we communicated and connected with others outside of our walls. I will say that we were fortunate that we had just invested in some time and resources into digital communications, kind of elevating that, if you would, for our organization. We began that back in late 2019, and that definitely served us well, because we quickly learned that one of the best ways we can get our messages out were through emails, through text messages if possible, and to communicate, whether it was video messages or just constant communication. So, definitely navigating through uncharted waters.
Yeah. One, I really, and I don't know if this is when you sort of found your mojo, but one thing that I saw your team doing that I borrowed this and then gave it to other clients was the virtual beam signing. What a great idea. So could you just sort of walk us through that? Because to me, that really spoke to, figured out how to thank our donors, make them part of this campaign, but be safe and do it in a safe way. So can you just talk us through how you pulled that off and how the light bulb went on, and just take us through that, because that was really inspired. I really liked how you pulled that off.
Yeah, wonderful. Well, we were excited when we saw a partner nonprofit do that for their capital campaign here in our local community. So Jennifer, you know what we do a lot of times, if we can borrow those ideas and collaborate and connect and make the most of those resources. So that was done by another nonprofit, and we were just really fortunate to work through our IT team and our marketing and communications team, because unfortunately, while we would have loved to have had a community gathering, to see that final canopy beam lifted into place here just a few weeks ago. The fact is that we knew that we could not do that in this environment. Not to mention we were working in an active construction site. And so what we did, as you well know, is we invited donors, we invited our team members, our colleagues, our volunteer leaders to sign the beam virtually. It was all done online and accessing a web page, and as simple as typing in your name. And then our marketing team clicked their ruby red slippers together and created these beautiful vinyl wraps that then encompassed the beam, and it allowed so many people to be a part of that ceremony, if you will, distanced. And Jennifer, you might be asking yourself, well, the beam's going to be lifted into place, Lisa, but no one's going to see that beam when you open doors next summer. And that is true. So what we are going to do is we're going to have a place in the Timken Family Cancer Center that recognizes all of those names with some pictures of the beam signing, just to commemorate that event. So, it was a way for us to engage our colleagues and our donors in this project, and that has been a priority of ours all the way along. Again, distanced, unable to connect in normal, typical, traditional ways, we've had to figure out how we can be connecting with people throughout this process to keep them in touch, engaged, and informed on this project. And that virtual beam signing was certainly one of those ways. Great. But I'll say, Jennifer, if you don't mind me mentioning too, one of the things I think that was very complex for us was in 2020, we actually paused on our capital project. Mm-hmm. We were talking in the summertime about, obviously, again, our focus as an organization had shifted, and it caused us to pause and rethink the project. Not the fact that we were doing the project, we were simply moving forward, but rethinking the timeline. And also, COVID impacted the way that our healthcare leaders work and operate. And were we building a center, a treatment center that was going to be able to address all of those needs? And so as we paused, we felt the best thing to do was to be very upfront, open and transparent with our community, and most importantly with our investor partners. So we sent a letter in July of 2020 letting them know that we were as committed as ever to the Timken Family Cancer Center project. But the fact is that we were going to pause and reanalyze the time frame, and that we would be keeping them informed. But again, I think that openness and transparency was important for us as we look to build relationships and trust in our community. We wanted our partners to know what we knew and keep them informed.
And so then what was the reaction then from your partners and stakeholders when they received that? How did that make it? What was the reaction? What was the feedback like?
We were overwhelmed with the support and the encouragement and the praise for taking the time to make sure that we were addressing all of the needs, and most importantly, addressing the needs of our community. And that was with regards to the COVID-19 pandemic. And so very encouraging, a lot of support, and we felt, very blessed and fortunate. We did not have one investor partner or anyone, even patients, question that pause and that time that we took, if you will. So it was great feedback. Thank you for asking.
That's great. So it really just strengthened your relationship.
Amen.
Yeah. And how would you say, as you're moving forward and you're building and strengthening these relationships, and we are still in a pandemic. I mean, at least here in Ohio, we still feel that. What ways are you continuing to inspire your community? I mean, how are you still continuing to inspire them to make gifts, whether it's to the cancer campaign or otherwise? What creative ways are you reaching out?
So one of the things that we've done, and this isn't unique, but we've leaned more on video than we ever have before. And as I mentioned, the patients are the why of this project, and there's no stronger voice or advocate for the need for this project. And one of the things that our team was involved in this, especially this last year, was connecting with our patients and asking them to share their personal journeys and testimonies with us on video. And we have been sharing those. We shared them throughout the month of June. It was Survivors Month, and we kind of like to think that we owned the airwaves that month. We had a great partnership with our local radio station, and they did a tremendous job of sharing those videos. We shared them on social media, and we continue to share them. And so that patient voice and those short video snippets talking about their care, talking about the need of the project, and just their reflection on the care, their care providers, their nurses, just, heartwarming and moving. Again, nothing more powerful. So one of the ways we've been able to keep the project in front of our community, to keep them engaged and excited, was all thanks to our patients.
Mm-hmm. I'm going to ask you a question that was not on our advanced materials. So I'm going to put you on the spot here. And this might be, you might want to bring in a marketing person for this question, but I'm thinking about our other clients. You said that you enjoyed a really great relationship with your radio station and that you owned the airwaves in June and it was Survivors Month. What about those hospitals that maybe don't own the airwaves already, don't have those relationships? But, we're in a pandemic and, media is a great way, and video and audio, those are great ways to reach out. What do you witness that your marketing department is doing to make forays into those areas? Or are you hearing those conversations? I mean, not around the water cooler, or are you aware of what's happening in terms of that or meeting those challenges?
Are you referring to the fact that, some of those are paid, if you will, and not
paid? I'm just saying that we're reaching this point now where we can't get the outreach that we used to because, we're in a pandemic and we've got to adapt. But it sounds like you at Aultman, and maybe you can't answer this, so I'm sorry if I'm putting you on this.
No, it's a great question.
But maybe, so it sounds like you have amazing relationships with media, and that you went into the pandemic with amazing relationships with media. So I'm just wondering, what about the hospital that maybe didn't go in with the benefit of having those relationships? What are some of the best practices that you've witnessed as a fundraiser that your marketing team is doing? Maybe something that you're witnessing that they're doing that you could pass over to us to share. Is there something that they're doing? Is there a way that they're collaborating with you? What is that relationship like?
It is a great question, Jennifer. And I would say that I would have to give the credit to those that came before me because it's all about relationships.
Okay.
Aultman Health Foundation, one of the things that we pride ourselves on is the connection to our community, the service to our community. We're an integral part. And I mean, our mission is leading our community to improved health. And so it's those relationships and those connections that have been built for years that allow us and afford us those access, if you will, to our media outlets. And so I have to say that it's really about the relationships and the connections. But I also think that, you know, we are at a time that when you have a sit down conversation with your local paper or your local radio station, you know, I would hope that they would want to be engaging with local regional, national hospitals to be able to share that information and to communicate to the community, to their audience, if you will. And so I think it benefits them. And it obviously in the situations that we had through the capital campaign, it was truly a blessing. I mean, our paper came out and I mean, Jennifer, this was before COVID, but we had this amazing insert in our paper that I can't even tell you how many multiple pages this is. It's a salute to cancer survivors. This was all about our cancer patients, our cancer services, and the Timken Family Cancer Center. And so this is just one example of the relationship. They allowed us to sell all the advertising in that. I should say the advertising proceeds from that insert benefited the cancer campaign. And so, you know, it really comes down to relationships and having these conversations and also planning. We began a lot of this work ahead of time. The radio campaign was something that we've been talking about for months. And what's important about some of these things that we've done with either our community and especially like the radio station is that these are programs now that will continue on year after year after year. They will be awareness opportunities, solicitation opportunities. And so they began with this capital campaign, but there are things that we're now going to be placing into our development calendar, if you will, for years to come. So.
Great. That's great. That's great. And I think that now we've sort of teased out, I would love to maybe have someone from your team on next year to talk about how marketing and development can work together with the media to really maximize. So thank you. Sorry for the getting into the weeds there, but I just couldn't help.
That's great. Great question.
We're just flying through this. Okay. So what advice would you give to somebody who is, you know, your peer in the industry and is thinking, you know what, I really want to do some donor recognition, but we're still in a pandemic. And, you know, this is a very complex time because we're in a hybrid situation. Lisa, what would you tell that person?
I don't think we can afford not to. And I think we need to get creative about how we recognize and honor. Obviously, right now, we're at the stage we're at in this particular project. We are working on a donor display recognition wall. But, you know, there are other ways to be engaging and recognizing donors, whether it is you're looking for a wall in your hospital or your facility to share that. I will tell you, Jennifer, the actual wall that we have in our main campus that recognizes our donors was created by our own media team. And I will admit we have a very talented media team, but God bless them. But they created something for us because we wanted it to be something we could change out annually. We can make changes to easily and have that flexibility. And it was not an overly costly project. It was very reasonable, but I think it's very distinguished and classic and a very nice way to call attention to our donors on an annual basis. But there are also another great thing, Jennifer, that we learned, and this credit belongs to Sydney Campanero on our team. She had a relationship with our local high school video production team. And they've come in and they've done videos for us very successfully, very, very well done videos. And it's a great partnership. The local hospital is supporting one of our local schools. It's giving the students an opportunity. It's helping them build relationships. And to be very frank, it's also been at a really reasonable cost for us because we have a relatively, we're a small team, small budget. So every dollar counts, and that connection alone. And my point of saying that is that's also a way to be recognizing donors in a unique and different way. So I think that I give credit to our team. We've gotten creative. We've needed to because of the costs that are involved. And so recognition ranges in a lot of different ways, depending on the project, who you're recognizing, and the purpose. One of the things we did this last year was we did a donor recognition video. It was the journey of giving. And again, Hoover High School came in and did a video for us and actually took our donors through the hospital to meet with individual physicians, and even some of our volunteer leaders participated, talking about how their dollars are changing lives and making a difference. And again, that was a video production, and we were able to share that not only with our donors, but also with our community. So I'm not the creative one on our team. I leave that to a couple of others, but the fact is that, you know, more people, more minds, identifying opportunities, Jennifer, and it comes back to relationships.
And I love, and I'm going to circle back to this, you mentioned it earlier, I love that these are things that have come about because of the pandemic, but you're keeping them in the calendar. They're now permanent. And regardless of where this pandemic takes us, you're going to keep doing them. And I love that. So that's just amazing to me. What an amazing way to grow. One last question. Is there anything that you would have done differently for the cancer campaign, for the donor recognition piece, any of it?
There were probably many things, Jennifer, that we would have done differently when we were going through the timeline day in and day out. So there's no doubt. I know we would have done things a little differently. And I think because we were navigating through uncharted waters and new ways of having to connect and share and raise dollars, I know that we would have done things differently. I would have loved to have had more time. And as we're navigating through different things and learning new ways, I think that if we would have had more time, that also would have been a blessing. But frankly, you know, the only thing, Jennifer, that really solidly comes to mind, and you're going to laugh about this, but we purchased way more marketing materials than we needed. And, you know,
like print materials,
our print materials. We did an absolutely beautiful piece on the Cancer Center. It says, you have cancer, and you open this up and you realize exactly how you can make a difference for those that are fighting this disease. And it's a beautiful piece. And we worked with one of our local marketing companies to make that happen. We had purchased more at the end of 2019, heading into 2020, anticipating more donor meetings and visits and connections. So if anyone joining us at the summit would like an example of a marketing material, just please let me know. We'd be happy
to share. We got samples
to send to you what we created. So I will tell you, we probably invested a little more than we needed to in marketing materials, because actually what we're doing today, along with a donor by my side, Tina Biasella, our Vice President of our Cancer Services, and of course, administration support, our CEOs have been fantastic in helping. That is what made the difference in this campaign, was that those personal one-on-one connections. Obviously before COVID, personal in person, but even after COVID, we got creative, and we even did a Zoom event gathering hosted by a couple of our board members, and brought people together in a unique way. We had meals delivered to everyone's door ahead of that dinner that evening, and we connected over Zoom and talked about the project, and people reflected on how cancer had impacted their lives, a lot of personal stories, and a lot of connection that evening. And I will tell you also a lot of fundraising success. So connecting in a lot of different ways. But
I'm hungry for it. People are still hungry. They want to know what's going on, and they want to know how they can be part of it, and they want to know how they can help. One more quick question to follow up on that, and then I'm going to let you go, get back to your day. So does that mean when you say you have all this collateral, how were you getting the materials in the hands of folks? Were you going electronic copies? Were you dropping things off in the mail for them? How was that exchange of information happening?
Both.
Okay. Okay.
Yes. A lot of times what we preferred before the pandemic, obviously, were those personal meetings and connections where we had a chance to actually walk through the materials together. This was a couple of the pieces that we created were actually specifically designed for that one-on-one conversation, if you will. However, When needed, we had electronic copies that we were able to send to people. Some folks just really prefer that paper copy as well. So yeah, we were really taking advantage of I know, me too, Jennifer. We were taking advantage of every opportunity we had to share in different ways. So
amazing, amazing. Lisa, thank you so much for taking us out of complexity and into clarity. I loved hearing a little bit more about your amazing campaign and its success and how you've been able to honor your donors. And I'm so excited to hear about what you have coming up next. Thank you again for making our summit so informational.
You're welcome. If I can just say one more thing, Jennifer, if I can just, thank the team that I'm blessed to serve alongside. Yes. It was their perseverance and their passion for what we do, and especially for this project. I know every member of my team, and including myself, we feel this just blessed and privileged to be a part of this Timken Family Cancer Center. But I'll tell you, one of the keys to success was the internal relationships. You touched on that with regards to marketing, but it was not only the work by those that I work with in the foundation, but connecting with our cancer center. The vice president and their team was just absolutely instrumental in partnering with us and through the fundraising side of things every step of the way. Our marketing team, our facilities team, just my hats off again on behalf of our entire team to our internal team here at Aultman for helping to make this happen. But of course, it wouldn't have happened without our patients, our volunteers, our board leaders. We felt very privileged, and we couldn't have done it without you and Bill, Jennifer. I appreciate all the support by helping.
You're amazing.
You guys are terrific partners. So on behalf of our team, thank you for all you do. We look forward, if we can be of a resource to anyone at the summit, we look forward to that. I know so many have been that resource for us in the past. We appreciate it.
Absolutely. Well, hopefully we'll be able to do a live Q&A. So I'm going to stop the video now. Thank you so much. And hopefully we can join you for a live Q&A.
Sounds great.
Thank you.